Jerry Agar on News Talk 1010.
All right, here's the chain of events. We had a great big expensive long gun registry, and a lot of people thought it was just wonderful because anything that limits guns is a good thing, they believed. Okay, so we had that, and then a lot of people didn't like it, and the Conservatives didn't like it, and they campaigned in part to get rid of it. They won a majority. They got rid of it. You'd think that would be that, but it isn't, especially here in Ontario, where the Premier and others in the Premier's administration refuse to believe that the long gun registry is over. They refuse to listen to the federal government, to Public Safety Minister Vic Taves, when the federal government says we ended the long gun registry, and we're not kidding. If you purchase a gun in Ontario legally, you're still subject to a registry. They try to pretend sometimes that it isn't a registry, but the fact of the matter is those who sell guns are mandated by Ontario law as it still exists today, or at least is being interpreted today. You must collect all the information that would be collected for a registry. So I don't know how, if it walks like a duck and quacks like a duck, it's not a duck. So this is now a fight between the province of Ontario, the federal government, and people who want some sort of sensible legislation as opposed to boondoggle legislation. And a McMaster study finds gun laws don't affect the murder rate. Caillin Langmann is a professor, Division of Emergency Medicine at McMaster University, and joins me now. Professor, welcome.
Hi, Mr. Agar. How are you doing?
I'm doing well. Did I say your first name correctly?
It's Caillin Langmann.
Caillin.
Yeah, I'm an emergency physician at McMaster Emergency Medicine.
All right, I like that name, Caillin.
Thank you.
What's the origination of that name?
It's Welsh.
It's Welsh. All right, then. So just give us kind of the thumbnail version of what your study discovered.
Right, so this is the only peer-reviewed study that has been performed on the Canadian information. Basically, we took all the statistics going back to 1974 in terms of homicide, spousal homicide, homicide by type of firearm, including long guns, as well as discharge of a firearm with intent. And we looked to see what things, including legislation, might be associated with a reduction in homicide, because we have seen a gradual decline in homicide in Canada since 1974. We applied 3 statistical methods that are often used in public health research. And what we found was that none of the legislations actually had a statistically significant beneficial effect, including the long gun registry. Rather, the reduction was due to socioeconomic factors, most importantly, the increasing age of the population.
You mean young people, especially guys, are more likely to shoot each other than older guys?
Yeah, that's been shown in the literature before. It's not entirely anything new.
Right.
As criminals get older, they tend to burn out, or they get a little bit more intelligent in terms of what they want to do, and homicide is definitely low on their range of activities.
Or some of them are already shot, so we're done with them now.
Possibly.
Okay.
Some of the other things that I think are important to note here, I mean, the long gun registry is one of the legislative implementations that were performed by the Liberal government in terms of C-68 and the preceding Progressive Conservative government. But there's other savings that I think could potentially be had in terms of firearms management in Canada. In particular, there's one thing called the authorization to transport a firearm, which I think is also another bureaucratic, costly event that doesn't really have any public health or safety benefits at all.
Well, let's talk about what people say about it. I mean, first of all, and I think you're saying statistically you have disproven this, but people will always say, hey, murder rate has gone down since we got the registry, therefore the registry worked.
Yeah, I keep hearing that comment, and the comment is one of those partial truths. In fact, the murder rate has gone down. But what you have to do is you have to look at the murder rate throughout the preceding time period before the legislation was enacted. The legislation was actually implemented in 1999. Prior to 1999, there's a steep decrease going all the way back to 1974 in homicide due to firearm, as well as just homicide by any other means, including spousal homicide as well. Mm-hmm. And so if you take that into account, which you have to if you're going to do this type of statistical analysis, you find that post-legislation, there's no decrease in that decline. In fact, the decline is actually blunted, as if some people might say the legislation actually made things worse. I don't think that is an effect of the legislation, but it doesn't look like it's helping in any case.
I'm talking to Caillin Langmann, who is with the Division of Emergency Medicine, McMaster University. The other thing that is pointed as a success indicator for the long gun registry is police used it all the time.
I mean, I was present and gave testimony during C-19. There was many police officers. There seemed to be this discrepancy between the chiefs of police as well as the frontline police officers in terms of how useful the registry actually was. If you do read the actual RCMP report, you do find in the report that police officers on the scene actually rarely use the registries, even in terms of domestic violence calls. And that was actually one of their findings where they thought that they had to actually start increasing their use of the registry checks. It might be that frontline officers just didn't find it beneficial.
Well, because the frontline officers have said to me they didn't find it beneficial because even if they did a check of the registry and it said no gun registered in the house, no sensible police officer went forward as if there literally was no gun in the house.
No, I've been told that by the same police officers as well. And I think more importantly is if you do look at the literature, you find that criminals tend not to get firearms. They don't buy them from the stores.
You think?
I mean, it's obvious you wouldn't want to. It's easily traceable. But there is this culture where they trade firearms amongst each other. Mm-hmm. And that seems to be even in places where it might be easier to procure firearms where they get them from.
Well, they take a comfort in knowing that there is no paper trail on that gun.
It would seem obvious.
Yeah, okay. I just got an email from someone here who may be making a sensible argument that Vic Taves should butt out when it comes to Ontario. In-Depth Radio, News Talk 1010. I'm Jerry Agar. We have a fight going on between Ontario and the federal government. The federal government got rid of the long gun registry, and they are saying emphatically we really mean it all across the country. And the McGuinty government is saying we don't care. We're going to have a gun registry anyway. They have tried to sometimes say, well, we don't really have a registry. We're just making everybody write all the information down in a book, which you have to keep at the gun shop, which the government could then come over and ask for. So how that's not a registry, I'm not sure. But McMaster University came out with a study saying that the long gun law and gun laws don't affect the murder rate. Homicide numbers in Canada low and getting lower, but for sociological reasons that have nothing to do with gun control. And I'm talking to Dr. Caillin Langmann, Division of Emergency Medicine, McMaster University. So, Doctor, here's an email from a guy named Jason. He says the Ontario law has been in place for 30 or 40 years. It was in place before the gun registry was enacted by the federal government. So it's a bit much for Taves to try to force Ontario, in effect, to repeal a law that existed before the long gun law came into effect. So what do you think?
It's interesting. He's not incorrect that the gun stores have been under a mandate to record the names of individuals purchasing firearms. The chief firearms officer, including Mr. Wyatt in Ontario, is under the direct control of the RCMP, which is under the control of Vic Taves. So in that manner, I guess legally he does have that obligation to enforce federal law. It is interesting to note that also in the United States, stores under a federal firearms license, they also are required to record purchaser information. Unfortunately, that information has often gotten into the hands of criminals and been used to acquire firearms by stealing them from people's houses.
Yeah, let's emphasize that for a second. That has happened. People have broken into the gun store, stole the book, then went out and said, okay, here's where we can get guns. I don't know why they didn't just load up on guns once they were in the gun store, but regardless, they seem to want to also go to homes that they know will have a gun that they can steal.
Yeah, and in fact, the registry itself in Canada has been violated several times. And that's just the number that we know. I know Dr. Gary Mauser has looked into that. And it does seem interesting that there have been several notable cases where Canadian homes have been invaded specifically to acquire firearms that somehow people knew were there.
Public Safety Canada says by 2006, the cost of the long gun registry had exceeded $1 billion. That was the cost of firearms registration in general, but most specifically the long gun registration. And you are saying now, Doctor, that your study at McMaster University is the only peer-reviewed study in Canada to take a look at statistically whether or not there was a positive result in society from the long gun registry, and you concluded no.
I conclude that for both. Yeah, definitely. And I think there are other savings that can be made if you do apply the rest of this study to Canadian firearms legislation. As I mentioned earlier, the ATT is one of them, where you are required to have this sheet of paper, every licensed firearm owner in Canada, to take their firearms to a gun range or to the gun store or to the border to go to gun shows in the States. And this is a bureaucratic nightmare. Basically, firearms owners are waiting weeks at a time, sometimes months, to have a bureaucrat print out this form. Meanwhile, all firearms owners are already screened every day. The licenses are run through criminal record and background checks. So it seems to me another redundant bit of legislation that the study hasn't shown to have any beneficial and positive effects from. And in this day and age of austerity, I think that we should start, and this has always been my case, that we should start taking this money and applying it to things that are beneficial towards preventing violence, in particular spousal violence, such as women's shelters and more training for the police in terms of how to deal with domestic disputes, and more interventions in terms of some of the young people that are.
Yeah, there's a lot of positive could have come out of an expenditure of $1 billion that was in effect just wasted on the long gun registry.
And it's still going.
All right, I'm going to ask you one more thing. Last week I was in a bit of a debate with one of our councillors, Shelley Carroll, because the city of Toronto also has made noises about having their own gun registry, and she brought up, this was her argument, she's for gun registry because, women are killed by husbands with guns. What would you have said to her?
That's not entirely untrue. I mean, women are killed by their husbands with firearms. It's a very tiny number in Canada. Not to say that it's not important, but it's on the list of things that kill women. It's almost medically, it's almost insignificant. And certainly, as has been shown by Dr. Mauser and myself in this study, that this gun registration has had no effect in reducing the number of women that are killed by firearms, and as well as the number of men. So I would say, rather than spending that money and wasting it on that kind of feel-good legislation, spend the money on something that actually is going to help women. And as a medical doctor, I have significant difficulty sending patients to psychiatry or to women's shelters because there are simply no spots available. I
appreciate your time today.
Thank you very much.
Thanks for doing this. Dr. Caillin Langmann, Division of Emergency Medicine, McMaster University. Here's